Right now, a massive campaign is underway in Gaza to vaccinate 640,000 children against polio. This all started after a 10-month-old baby got the virus and is now partially paralyzed. And right now, Chicago area nonprofit MedGlobal is helping with the vaccination efforts. It has dozens of doctors and nurses on the ground helping to give out these doses. And joining us now is MedGlobal co-founder Dr. John Kaler. Dr. Kaler, thank you for being with us on the show.
Thank you for having us.
And we appreciate you being here to talk about this because you're based in Chicago, but your teams, your medical teams on the ground in Gaza are there. What can you tell us about the work that they're doing and just the conditions that they're facing there?
Well, first of all, the campaign in general is going remarkably well. The World Health Organization, this is the end of day 3. I'm not sure what the final statistics are, but at the end of day 2, the World Health Organization said that over 150,000 doses of vaccine have been given to children under 10 years of age. That actually meets the timeline. This whole thing is to be done in 9 days. The target population is 640,000. 90% efficiency puts it at about 570,000. So it's going quite well. The 3 major issues, though, obviously, are safety. This is not a ceasefire. This is a pause in activity from 6 o'clock in the morning, which is when you can then leave your shelter, to 2 o'clock in the afternoon when you need to be back to your shelter. So all of this is being done basically in 9 days of about 7 hours working per day. They're starting in the middle because that's the safest area. They'll move to the south in a couple of days, and then they'll move to the north 3 to 4 days after that. So it's going remarkably well.
And has your team actually seen these pauses in fighting? Do they feel, have they talked about just worried about being worried about their safety moving through?
That's a great question. The answer to your question, of course, is there's always worry about safety because it isn't a ceasefire.
Yeah.
There's been these temporary pauses for other activities in the past, which have failed. There's been a couple that have worked. The real issue here is that, of course, it isn't just safety for the healthcare workers, it's safety for a group of people who have been under stress for almost 11 months now. All of our healthcare workers are Palestinian, so they've all both served and suffered. This is a remarkable team of people, and I couldn't conceivably be more proud of them.
And Dr. Kaler, you talked about safety obviously being one of the biggest challenges there, the #1 concern for them. Any other obstacles or challenges they're facing right now? Because this is a very big undertaking with so many children needing to be vaccinated.
That's a great question. It's a huge undertaking. And it really is only one of 2 parts because the series is actually a series of 2. So in point of fact, this whole 9 days of temporary pauses has to happen again in about 4 to 5 weeks. So the logistics of this are amazing. The World Health Organization with the local health community is doing a remarkably good job. Our teams are on the ground and working alongside our other colleagues, and we're both servicing centers as well as moving world community health workers into the community to distribute these things. In other situations, without the war, this would take a much longer time. These logistics have been jammed together because of the crisis.
And we know this all started after the 10-month-old boy was the first to be discovered with polio in Gaza in 25 years. The World Health Organization says, though, hundreds more could be infected but not showing symptoms. So what are the chances this virus has already significantly spread?
Oh, there's a 100% chance, meaning this is a virus that is very, very contagious with very low disease. So by the time you start seeing disease, there's hundreds of cases. So the answer to your question is it's 100% sure that there are more cases, there are more asymptomatic cases in the Gaza Strip right now, 100%.
Thank you so much for joining us here on the show. We know your medical teams are so hard at work right now. It's hard to even imagine the conditions they're facing. MedGlobal co-founder Dr. John Kaler, thank you for being with us.
You're welcome. Thank you for having me.